on testing and accommodations for common learning disorders. Really quick, there's a couple of reasons why I really got interested in this. One was my sister, who was a child of the 60s and 70s, had undiagnosed reading disorder for quite some time. And it was, I saw just how much suffering she went through, struggling, people questioning her motivation, her desire, claiming that she wasn't putting in effort. And there was a really emotional burden on her, and how freeing it was when she just got the diagnosis. And fast forward, this is a woman who studied chemical engineering at Georgia Tech and is now a partner in a law firm. It was very helpful for her to get that diagnosis and then get the help that she needed to do that. I also like testing and accommodations for learning disorders and ADHD because it's just a really different kind of work. It's than the typical kind of trauma, substance abuse work that I do. So I've worked for, I do some private practice where I typically work with 16 years and up, but then I've also worked at University of Akron. And a part of what I do would do testing and accommodations for learning disorders, ADHD, but I'd also review people's previous school records. So I'm gonna talk about this a bit more from the 16 and up, because my expertise is really not 15 and below, but I've certainly reviewed those records and have a sense of what should be there. The other goal of this is obviously not so you learn how to do testing for common learning disorders, but my hope is that you understand if you ever refer one of your patients for psychological testing, that you'll have a sense of what you should be looking for, what information should be there, that may help you in other ways of working with that particular patient. And I don't know why I can't. I think you have to see my side screen. So I can go through pretty quickly because I know we have a case, and that's really what the people want, is to hear the cases. So we're going to look at practices again in more adult psychological assessment for common learning disorders. Look at some of the standard batteries, some of the things that may affect test performance, and then some typical accommodations for learning disorders. So briefly, learning disorders are a general set of disorders that affect a number of things: academic skills. It can affect input processing, decoding, storage, that persist at least 6 months despite intervention. So that's one of the things that's it's complicated when you're in my line of work to determine, did the person have adequate intervention? Were they at an adequate school? Were there people who were actually supporting this student to determine whether or not a learning disorder exists? Because we know that some people go to deficient schools. So sometimes it's hard to determine, is this a product of a deficient school or is it a learning disorder? Really challenging. There's not exactly perfect ways to disentangle those issues. You just sort of do the best you can. And in my world, we would oftentimes refer students to specialized tutoring for 6 months and then reevaluate and see where they were at that point. So that's one of the things that we do. They're oftentimes hidden, very much like I talked about with my sister. The prevalence is estimated between 5 and 15% in the United States. I can go through the criteria pretty quickly, just DSM-5 criteria. So it's ongoing difficulties in school-age years, typically in at least one academic skill, so reading, accuracy or fluency, spelling accuracy, written expression, competence and fluency, mastering number facts. And as I mentioned before, it's persisted and failed to improve as expected despite provision of a targeted evidence-based intervention. Again, that's one of the really hard pieces to determine. Criteria B, this is where I kind of come in as a psychologist, is that you're using standardized achievement tests as well as a full comprehensive assessment to determine if there's a disability. Because what I'm really focusing on in this presentation for accommodations, it's not the presence of a disorder, it's the presence of a disability. Typically you're looking at 1.5 standard deviation below same age peers is evidence of a learning disorder. At 17 years or older, a documented history of impairing learning disorders may be substituted for a full assessment. But oftentimes, like in my work, I'd be working with people who are maybe going to be taking the GRE or the MCAT or the LSAT. So they would need to do a full new comprehensive assessment to see if they were eligible for accommodations for those tests. Criteria C usually becomes apparent in the early years of schooling, though sometimes they may present a little bit later, because sometimes a student may be able to kind of overcome the disorder for a bit of time until the work gets more complicated and the expectations get higher. So sometimes it may come on a little bit later years in the upper primary or secondary school. That's in particular for math. Math in particular may not really rear its head a math disorder until you're more in like the 6th grade, 7th grade kind of range, because people can oftentimes overcome earlier on. And clearly you wouldn't diagnose a specific learning disorder if there was other plausible explanations. So an intellectual disability, which is why you're going to see that we do cognitive testing as well when you're doing a learning disorder assessment, any kind of sensory impairment, chronic absenteeism, inadequate proficiency in language of instruction, other psychosocial conditions. So it's complex, which is why the assessments are pretty comprehensive. So essentially all 4 of those criteria must be met, and then you determine the level of functional impairment, like in other aspects of the DSM-5, by mild, moderate, or severe. And it really has to do with that, that kind of Likert scale, the degree of functional impairment, and as compared to other peers, as well as the amount of support they need to be able to catch up to or be close in line with their same age peers. I'm going to really briefly go through this. So you can have a learning disorder with impairment in reading. It's about 4% of US school-age kids. And that's things like decoding, like being able to appreciate that these letters make up this word and this word has this meaning. Fluency, so kind of the speed of reading, letter word recognition, phonemic analysis. And some other things I just want to highlight here is there's also kind of like with ADHD, which can get complicated. There can be some short-term, especially auditory memory deficits, as well as processing speed deficits, which also co-occur with ADHD, which is why there's oftentimes a bit of a trying to determine, is this ADHD or is it a learning disorder? Obviously, there's some distinct criteria to make that clear, but just to say that there is some overlap. There's also learning disorder with written expression. Prevalence is difficult to identify. It's also sometimes a little hard to disentangle written versus reading disorder, because obviously there would be some overlap. I'm going to move on from that though. And then you have learning disorder and impairment with math. About 1% of school-age children, many people believe they have a learning disorder when it comes to math. And you think about people who say they just can't do math. That's oftentimes more often sort of a motivation in adequate educational experience rather than a true disorder with mathematics ability. But nonetheless, many people will believe that they do. And like I mentioned, oftentimes math impairment comes up later. So what is the impact of learning disorders? Quite significant, and we don't think about it much. It can affect a lot of different areas of one's life. Again, just thinking about in my own family, how much stress and strife there was when there was this perception that my sister was, lazy or not working hard. Clearly that can affect a lot of things. 35% is estimated of people with a learning disorder drop out of high school, which is twice the general population. Significantly fewer people with learning disorders attend college or graduate school. 43% are at or below the poverty level, and 48% are out of work or unemployed. So there's some significant issues with learning disorders. And one thing I'll also say is that it's not uncommon for me to have worked with people where it seemed clear by educational records they had a learning disorder, but either their school was not equipped, especially if you think about folks who are older, like over 45, to actually do an assessment, or families didn't want that label, so therefore they didn't allow their children to go through the assessment process. So sometimes you do, especially again, older folks, like I'm not thinking about really the 30 and under, it's really like the 45 and over. Many of those folks fell through the cracks. Some common other characteristics, there's some kind of general developmental delays that can occur. It's interesting, my sister, she used to have to write L and R on her left and right hands because she could never remember. And to this day, when she's setting the table, she'll still put the silverware on the right-hand side. It's very common for her. So it's, you know, there's these kind of other things that you'll notice. Trouble learning ABCs, rhyming words, and other types of developmental issues that you'll notice across reading problems and writing problems and other cognitive problems. And there can be some social impairment as well, where people come across sometimes is if they're having a hard time following conversation and having a hard time understanding how to engage in conversation. So then you get into like, okay, then you begin to wonder about autism. So it can be you know, and obviously there's symptoms that don't co-occur in those issues, but I'm just kind of getting at it. It's challenging and you have to do a really thorough assessment. Like I mentioned, some of the social characteristics, there can be few friends that can relate to being perceived as not effective in school. There can be bullying. Sometimes they're perceived as liars, like, no, you didn't work on all that schoolwork that you said that you did. You really didn't work on that paper when they did. They can also have a poor recall of events. That's really common, where people will have a hard time because part of it is long-term memory issues. So that is a hard time with accessing memories and internalizing memories. So sometimes there's just not a recollection of what happened, and people will believe that they're lying or they're just trying to hide something rather than a disorder. So you can kind of see this can really affect people's perception of somebody in a way that can be really harmful. Emotional characteristics, there can be low self-esteem and low efficacy, difficulty managing stress, and oftentimes they're experiencing a lot of stress, some frustration, anger, family discord. So there's a lot of things that can occur, especially think about children, and one of their main tasks at a certain point is being effective at school. And if they're not effective at school and no one understands why they're not effective at school, that can be really harmful on a lot of levels. So when you're thinking about an integrated assessment, you really have to take into account ADA amendments, the 504 Rehabilitation Act, the ADA. When you're working in higher education, Association of Higher Education and Disability, the needs of the patient, Office of Accessibility, whoever the third party is. You're also obviously keeping up with the scholarly literature to see what are the best practices. And there's always this cost-benefit analysis. I mean, you could assess people for 5 years, right? And have a really thorough assessment, but oftentimes that's going to be too costly and take too much time. But what you really want to do is have a number of measures. You want to use multiple measures that tap symptoms across that issue. So a balanced number or orthogonal measures. So you're wanting to do a few measures that are tapping the same thing. So for example, if you're concerned about a reading disorder, you're going to do a number of different tests around reading, and as well as you're ruling out some other things, right? So what's a typical battery example? And this is considered best practice. So you're going to want to have your comprehensive clinical diagnostic interview. You're going to want to have a semi-structured interview that's specifically for learning disorders. You're going to want to try and get as many academic collateral records as you can. You typically do a mental health assessment. I use the Minnesota Multiphasic Personality Inventory, MMPI, because it also has validity scales that you can determine if somebody's faking bad or faking good. It can be helpful to know if someone's malingering, because there are benefits to being diagnosed with a learning disorder, as you will see, which are some of the accommodations. So you want to be able to determine that, no, it seems like this person was putting in their best effort and that we believe that their results are valid. The Woodcock Johnson 4 is really the gold standard test of achievement. And unbelievably, you can actually assess people from 24 months to 90, to age 90. They really do make a diligent effort of having stratified sampling, so that you have people who are regionally diverse, racially diverse, socioeconomic status diverse, occupational status diverse, because really the goal is to avoid bias toward any specific group. In my neck of the woods, where I would do college and university counts assessment, It is helpful to look at that specific sample. Sometimes when I'm trying to determine does something meet the criteria of a disability or not. So they do have a college university sample that you can also compare folks to. So the Woodcock Johnson is 20 tests. It's organized into 5 areas: reading, mathematics, written language, oral language, academic knowledge, which are things like science and social studies, and other supplemental tests. So again, if you're concerned about a math disorder, there's a number of other supplemental tests that'll tap different dimensions of a math disorder. It's like other intelligence tests. This is not an intelligence test, an achievement test, but it's designed to map on. It's a mean of 100 and a standard deviation of 15. The standard battery includes 11 tests and takes about 60 to 75 minutes to complete. And typically what you're doing with the Woodcock Johnson is you're comparing people's scores to their age or their grade-based norms. So you're seeing how they compare to their peers, basically. And then you typically would report and interpret that score of total achievement. And you'd look at it, is it discrepant from their peers? But then you also look to see if it's discrepant from their cognitive abilities. So basically what we typically call an IQ test. And what you're looking for really, again, is that 1.5 standard deviation below their peers and a standard deviation and a half below their general cognitive abilities via an IQ test to determine if that disorder, or if the disorder exists, but if the disability exists. So disability is when it's discrepant and below the norm is when you're beginning to look at, okay, this is also a disability. You also would use an intelligence test because you are comparing their achievement to their aptitude, basically. But theoretically, if a person is achieving at about the same level as their cognitive aptitude, then you would think, okay, that kind of makes sense. If, however, they're underperforming an achievement, their aptitude or their IQ, then that begins to say, okay, there's some kind of gap there, and therefore there might be a disability that exists. Those of you who saw my ADHD presentation heard much more about the Wechsler than what I'm going to do now. But I guess the important part is that intelligence by the Wechslers is defined as a global capacity of a person to act purposefully, think rationally, and to deal effectively with his environment. And it's conceptualized as being composed of a number of different interrelated elements that are individually measured. So that would be this, like intelligence is conceptualized as being these 4 domains. So verbal comprehension, things like definitions, and these are basically information that you would learn from your culture, right? Perceptual reasoning, which are things that are visual spatial processing and things that you would not have learned from your culture. So they're typically novel tests like block designs or puzzles or things that you wouldn't have learned culturally. Working memory is another aspect. So it's things like asking people, giving them a string of numbers and then asking them to say it backwards, right? And then processing speed is basically testing a person's ability to react to information they receive, attending to content and concentrating, and typically they're timed. So things like symbols, like matching symbols, like, okay, that symbol matches here, that symbol matches there, and doing it very quickly. With ADHD and learning disorders, working memory and processing speed typically tend to be diminished to some degree in comparison to overall IQ. So the working memory and processing speed are affected with both types of disorders. So what are scores influenced by? Obviously, you just heard that, I mean, an achievement test is to some degree measuring what one would have learned in US culture, English speaking, with an adequate school, right? Not everybody clearly has that or comes in with that. So language, culture, opportunities, just general interest and curiosity affect things, which is why you are, you know, there's ways when you're testing folks if English is second language or maybe they've had just very different cultural experiences than what the, you know, typical quote unquote US student would, that there's ways that you factor that into your assessment, right? So you just don't treat it like everybody's the same. Family environment, environmental toxins, motivation and persistence. Anxiety, which is why that, you know, you may be wondering, why did you screen for other mental health issues at the beginning? Because obviously things like depression and anxiety and other mental disorders can affect all the things that we're talking about, and could affect someone's educational abilities when you're thinking about concentration and interest in things. So you're going to want to try and determine, you know, to what degree is this maybe a mental disorder, and what degree is this an actual learning disorder. And, you know, we're human beings and we have bias, and even different people who are being assessed have different relationships with the person doing the assessment. And there is some research that suggests, for example, males testing males, there's some benefits, females testing females, there's some benefit. And it really has to do with comfort with the person who's doing the assessment. So there's a lot of things to consider. More of a battery example are validity checks. So again, I mentioned that there can be some benefits to getting time and a half on tests. Like imagine those of you who took the MCAT or the LSAT or the GRE, if you'd had time and a half on that, that could be beneficial, right? So you may be trying to do that. So, you know, you don't want to go in with the mindset that people are trying to game you, but it's possible. So it's good to have validity checks to determine whether or not people are kind of malingering or faking bad. Also, if you just think it's really perhaps just, not just, but a memory issue, you may want to use the Wechsler memory scale. And essentially what happens is, so you're synthesizing all that information, which is really the fun and interesting part for me. And you then to try and determine, okay, what's a treatment plan that makes sense? And then you provide all that information to your patient and kind of come to some agreement of what things mean. Oftentimes if you're in higher education, the recommendations include meeting with the Office of Accessibility. If it happens to impact employment issues, that would be human resources. And obviously when you're thinking about younger kids, you're thinking about trying to get IEPs perhaps, or 5014Cs. So it's, you know, basically you're trying to collaborate with folks who are going to be able to give that student the support that they need and the accommodations that they need. So I mentioned this a bit before, but, you know, part of what we're doing when we're assessing for a learning disorder is for accommodations is not that it's a disorder, but you want to be able to argue that yes, that disorder is on board. But then it's the second step is, does that disorder actually lead to disability impairment, which is a legal definition, which is why when you're doing the kind of work I do, you're reading a lot more court reviews than anything else, because you're trying to see what have the courts ruled in favor of in terms of accommodations for students, what's kind of the legal precedents. So essentially what courts are a little all over the place. So some would argue that really what's most appropriate is to compare the student to their peers, right? Some have also argued that you could look at intrapersonal comparisons. So if my math ability is significantly lower than my other overall achievement level and significantly lower than my IQ, then that would be enough. Some courts have argued with that. Typically in practices I've worked at, we've looked at both and wanted to see both on board. So not only are they at a level significantly below their peers, but also that particular disorder is significantly lower than their overall IQ. Clearly people can have a number of different disorders. So people may have a math disorder and a reading disorder and a writing disorder, and then those would all be expected to be lower. But you would also expect that those would be significantly lower than overall IQ, and especially things like perceptual reasoning, which is like those math, or not those puzzles that are kind of unique and aren't culturally based necessarily. So what are some, this is a really interesting thing. There is really very, very little empirical evidence to suggest accommodations are, how can I put it? There's evidence to suggest that they're helpful, but they would be helpful to all of us, right? If I could take, I mean, my daughter who's in 6th grade would love to be able to use a calculator for her math test, right? She would probably do better academically. So that's the hard part, is that people with accommodations, all of us would do better. And there is lacking evidence to suggest that it's a meaningful improvement over and above the norm for someone with a learning disorder. Same goes with ADHD. That's not me saying that people shouldn't have it. I'm not saying that. I'm just saying there's not really the evidence to support the efficacy of these accommodations. However, the courts have ruled that they're important and necessary for giving people equal access to the learning environment. So typical things are 50% extra time on tests, testing in a distraction-reduced environment, test-taking prompts, being able to use a calculator or spelling and grammar assistive devices for exams, note taker for classes, having the ability to get proofreading from your teacher before you've actually submitted your final paper, so they kind of do a run through with you, tape recording lectures, access to archival classroom lectures. So those are some of the typical accommodations that are generally thought of as necessary for folks who meet criteria for a learning disorder. Other recommendations clearly include, can include personal educational career counseling. Like I mentioned, it's not uncommon that, because of having a learning disorder, people may also not have had as much experience with some of the other active reading strategies and some of the writing workshops that could be beneficial to them. So you want to try and get people not only accommodations, but also help with, kind of like general tutoring you would think of, academic support services, vocational support at work, other types of community resources. Sometimes you might be doing clearly a physician psychiatric referral, state rehabilitation agencies, and occupational therapy. So those are some of the typical other recommendations that one would think would be helpful for folks with a diagnosis of a learning disorder. And then last is just the references that weren't embedded in the PowerPoint are there, so you'll have access to those. And that's my story, and I'm sticking to it.